Throughout recent years, depression has been an omnipresent illness being talked about more and more due to its stigmatization across our society. Even after many years of research, treatment, and prevention, depression is still one of the more common mental diseases out there. In fact, depression is an important mental illness that needs to be treated as soon as possible due to the impact it can have on the life of the person suffering from it. First of all, I'm going to talk about the causes of depression. There are many factors that could put someone at risk of suffering from a depressive disorder. The main ones are heredity. If some of your family members have suffered from depression, you will be more at risk if things go south for you. And your sex. 9% of men and 15% of women are diagnosed with a depressive disorder at least once in their life. Why is it that women are at 15% while men are at 9? Well, that's because generally, women are more willing to get psychological help. They live way more hormonal changes than men, especially during their periods, and historically, because of social pressure. Because let's be honest, women did not have it easy the past centuries. Then there is the socioeconomic status, the relationship status, as well as your age. But beyond the risk factors, the usual causes are biologically an hereditary vulnerability or an anomaly in the main functioning of your prefrontal cortex. And psychologically, the role changes that goes along the age problem that we saw in the risk factors because between the age of 15 and 34 you are more likely to have life role changes. Also, negative thinking about yourself, your environment, and your future. And socially, if you're close with someone who has depression, you are more likely to become depressed because of the burden it can have on your relationship. Now, let's talk about the symptoms of depression. Following the DSM-5, which is a benchmark used by psychologists and therapists around the world, here's what you need to have to be officially considered depressed. You will need to have depressive humor practically all day, almost every day, few interest and less fun during daily activities practically all day, most days, a 5% weight loss or gain without any sort of diet, insomnia or hypersomnia almost every day, psychomotor agitation or retardation, fatigue or energy loss almost every day, depreciation or excessive inappropriate culpability almost every day, attention and focus diminution along with indecision, and also frequent death thoughts, suicidal ideas, or even attempts. To be diagnosed with a depressive disorder, you will have to suffer from at least 5 of those symptoms for at least 2 weeks. Some of you may not know about the fact that there are different types of depression. First of all, there is the depressive disorder, which is, in some way, normal depression. In 2019, people are still being stigmatized for being depressed. You only need one major depressive episode to be diagnosed, and most people suffer from more than one episode in their lives, meaning that depression is a chronic illness. Then, what we have on the right is the classic vicious circle of depression, characterized by a loss of interest and motivation, inactivity, loss of energy, a feeling of guilt, worthlessness, sleeping issues, and a feeling of sadness. Then there's the persistent depressive disorder, also called dysthymia. The persistent depressive disorder is exactly like the normal depressive disorder, with lighter symptoms, but over a way longer period of time. In fact, to be diagnosed, you need to suffer from depressive symptoms for at least 2 years, in opposition to the normal depressive disorder, which is only 2 weeks. Another type of depression is the postpartum depression, which is a type of depression that appears during the first month following the delivery. 60% to 80% of women feel sad, nervous, or anxious during the first month. 10 to 15% eventually gets diagnosed with a depressive disorder because their postpartum depression lasted too long. And postpartum depression usually disappears way faster than a normal depressive disorder would. The main causes are hormonal changes, being disappointed by the experience of the delivery, the feeling of loss after the pregnancy, especially extra love or extra attention that the woman was usually getting because of the huge belly, the degree of marital satisfaction, the difficulty of taking care of a newborn, the lack of social support, and also exhaustion. And the last type of depression is the seasonal depression, which is mainly due to a lack of sunshine exposition. So it's more likely to appear during winter. And if depression wasn't problematic enough by itself, there is often a lot of comorbidities coming with it. For your information, a comorbidity is the coexistence of two or more disease processes at the same time. The main one being panic attacks, substance abuse, sexual dysfunction, anorexia and bulimia, as well as personality troubles. Finally, let's talk about the most common treatments. The first one being the cognitive behavioral therapy, which consists of meeting with a therapist over at least 15 weeks and figuring out the cause of the problem through the cognition and the behavior of the person who's depressed, then fixing it by modifying both. This treatment involves learning to control the negative thoughts that led to loss of interest and feeling of worthlessness, to combat the emotions of sadness and hopelessness, and a loss of energy, even when not physically active, but especially to counteract the behaviors related to poor concentration and thoughts of death. The second one is medication, also called pharmacology. Often used alongside the cognitive behavioral therapy, the prescription of antidepressants has proven to work for many people, but some others still doubt its effectiveness, probably due to the risk of relapse after the end of the treatment. But some things you will need to remember if you are ever prescribed some antidepressants are to take the medication daily, to never stop the medication without contacting the health professional who prescribed it, that the side effects lessen as your body adjusts. If the side effects don't diminish or unreasonable, you have to keep contact with your health professional, and to never stop the medication, especially if you feel better, because you will relapse. Then there's phototherapy, which is a good way of healing seasonal depression or just feeling a bit better during winter times, but will not cure many depressive disorders. In conclusion, depression is an important mental illness with many causes and dangerous symptoms, as well as different types of disorders that could lead to even more dangerous comorbidities. However, there are different ways to cure this illness, and if you feel abnormally sad, please get some help.